Hi, my name is Dr. Khan and I'm going to demonstrate to you the examination of the lumbar spine. It is extremely difficult to sequence in real life scenarios in the clinical practice in a stepwise manner because patient present to you with varying symptoms, varying clinical features. So if the patient is with a severe low back pain, with radiation down to the leg, with radicular signs, obviously you cannot go on with all the steps like active movements. You straight away start with the examination on the line. But for the convenience, we will sequence it in a manner that we cover most of the features of the clinical examination of the lumbar examination. Right. We will start with an observation, move on to the movement things, palpation, then movements, and then obviously the special tests for to provoke the pain of different kinds. We will also include a quick examination of the hip and pelvis, because the features of the lower back pain and the hip and pelvis are almost overlapping in the clinical practice. Excuse me. Now we start with the observation from the side. Look for any thoracic kyphosis. Here, please. Look for any thoracic kyphosis. He has a very good sagittal alignment. And look for any hyperlordosis. There is none in the case of Vas. Now, can you turn around, please? He has a good shoulder and pelvic alignment in the coronal plane. I cannot see any star mark, any visible deformity, any step deformity, any muscle wasting on the examination. Generally, he has a good alignment. There is no asymmetry on the either side of the spine. Right. We will now move on to the palpation. We'll start the palpation right from the. Does that hurt, please?
No.
With the spinal processes, palpating the spinal processes, the whole spine. Does that hurt?
No.
Does that hurt?
No.
Does that hurt?
No.
And then the facet joints. Does that hurt?
No.
Does that hurt?
No.
Does that?
No.
So now we move on to the paraspinal muscles. Is there any pain here?
No.
Is there any pain here?
No.
Fabulous, Grant. Thank you very much. Now, we also palpate the PSIS, the posterior sphenoiliac spine, then the sacroiliac joint. It is ideal to palpate the hip on prone position, and we also, for the sake of the convenience, we are doing here in the standing posture. Greater trochanters, the piriformis muscle, and the tail of the sacrum. There's no pain on the tenderness. Now we move on to the movement things, and we start with the movement for the forward flexion. Can you bend forward and touch your fingers with the toes? Yes, pretty good. Forward flexion, about 90 degrees, that's fairly normal. Can you get back, please, to normal? And then backwards, please. I'll not let you fall. Fabulous. Thank you. Does that hurt?
No.
Yeah, right. We can also do to provoke the pain for the posterior element of the spine. We can move on with the one leg extending test, extension test, which is called the stroke test. Can you stand on left leg, please, and bend backwards? Does that hurt?
No.
And on the right, please. Does that hurt?
No.
Right, thank you very much. Fabulous. Right. We also check the lead reflection. Can you turn around, please, and slide your hand along the thigh, please. Fabulous. Does that hurt?
No.
On the other side. Excellent. Fabulous. So now a few other maneuvers on the movement while he is standing. The first is, can you tiptoe, please? Right, and take a first step. Fabulous. Thank you very much. So it shows that his S1 spinal level is pretty much normal. Can you stand on your heels, please? Fabulous. So it shows that his L4 spinal level is normal. Now can you turn around, please? And stand flat foot on the left leg, please. Yeah, kick your right leg backwards. Yeah, kick your right leg backwards. Look for any Trendelenburg sign. He has pretty good pelvic alignment. So it shows that his, and on the other side, please. It shows that his bilateral gluteus medius are having good power. Thank you very much. So it also implies that his L5 level, which applies to the gluteus medius, is of normal, is having normal power. Excuse me. Next, I always in the sports fraternity, sportsmen always ask the people to take a full squat, so that you have a general idea of the muscle power of the muscles. Can you take a full squat, please? Fabulous. Thank you very much. Now we'll move on with our examination on sitting posture. Can you sit down, please? Thank you very much. Right. While sitting, we start with the rotation of the lumbar spine. Can you cross your arm, please, like this? And right. On the other side, yes, fairly good amount of rotation in the lumbar spine. Thank you very much. Now we move on to the straight leg raising while sitting, and straight leg raising will demonstrate for any nerve root sign at L3, L4, L4, L5 and S1 level. Can you bring your leg upwards? Does that hurt?
No.
Any pain here?
No.
Any pain down in the leg or in the back is positive for the nerve root irritation. We can add the foot dorsiflexion passively to provoke the pain here. We can do it on the other side as well. Now we can add the slump into this, and adding the slump is, can you bring your chin to the chest, please, and bring your chest forward, and now straighten your leg. So this is the slump test. Any pain in the lower back or in the leg will demonstrate the nerve root irritation of L4, L5 and S1 level. And you can also add the dorsiflexion of the foot. Right. Can you straighten now? Right. If there is any hamstring injury, we can differentiate it from the nerve root sign by asking the patient to remove the slump, and if there is any pain in the thigh, it's probably coming out of the local injury to the hamstrings. Right, thank you. Right, next we move on to the power of the muscles. I always like to perform the power of the muscles while sitting, and it is fairly easy for me to do that. L2 level is hip flexion is at L2. Can you push against my hand? Right, thank you. The knee extension is, can you push against my hand? Don't let me move. Knee extension is L3. Now, the foot dorsiflexion is L4. Can you push against my hand and don't let me move? The big toe extension is L5. Push against my hand and don't let me move. And plantar flexion, push downwards into my hands, don't let me move. Plantar flexion is S1. So his myotomes at all levels are fairly normal and in a good power. We can also check the dermatomes and the sensory system of the lower back. At the front of the thighs, can you feel that? Front of the thigh is L2, medial knee is L3, can you feel that? Yes. Right. The medial ankles are L4, dorsum of the third toe is L5, and lateral ankle is S1. Fabulous, thank you. We'll also check the, you can also check the tendons, please. Can you just throw us a picture with that? Thank you. We'll also check the knee tendons here. Fabulous, thank you very much. Thank you. Slightly dorsiflex. No. Excellent. Thank you very much. Now move on to onto the examination where on lying position. Can you lie down with me, please? On lying position, the most important task in the low back examination is straight leg raising. You bring the leg passively upwards and look towards the face of the patient. Does that hurt pain? No. And any pain in the lower back or down in the leg, demonstrate the nerve root irritation. Right. If the patient feel pain around 90 degrees, pretty much normal. If less than that, patient feel pain, just lower down at the leg and add the dorsiflexion, and patient will feel again pain, and that is positive SLR. Right. Thank you. If we have any positive SLR on the leg with the clinical features or pain, we always perform the good leg straight leg raising. And if there is any pain on the affected side, while raising the leg on the good side, it shows that there is a bigger nuclear herniation. Right. Right. Thank you very much indeed. Excuse me. Next, we move on to the examination of a quick examination of the hip and pelvis. With the hip, we will see the flexion, adduction, abduction, and internal rotation, external rotation, and on the other side as well. We can provoke the pain and reproduce the pain of hip impingement, lateral tear, or by doing the hip flexion, external rotation and adduction, and on the other side as well. Right. You also can provoke the pain of the sacroiliac joint by doing the Faber maneuver, which stands for flexion, abduction, flexion, abduction, and external rotation. So it's also known as a figure of 4 test. So any pain here?
No.
Any pain in the back of the hip?
No.
Demonstrate the SIJ joint, SI joint deformity or SI joint anomaly. Next, to me, it's pretty important and fairly common phenomena with the piriformis syndrome. Tight piriformis often cause the hip pain and sciatica-like symptoms. So, to test the piriformis, you can do it in the 60 degree of hip flexion, where it causes the where it is responsible for the external rotation. So, can you push against my hand, please, inwards? So, resisted external rotation at 60 degree. Any pain here in the hip?
No.
Thank you. And 90 degree, we know that piriformis takes up, of hip flexion, piriformis takes up the function of abduction. So resisted abduction may cause pain in the tight piriformis. Can you push against my hand? And can you push against my hand? Can you push against my hand? Thank you very much. Now we can perform the. Can you lie prone for me, please? We can also palpate while lying the patient prone. It is pretty much easier for us to do the palpation while lying prone for all the major muscles. And we can do the femoral retention test here for higher lumbar root signs. Is there any pain here?
No.
So, and with the same maneuver, we can check the iliopsoas tightness, which is often one of the reasons for the back pain. Right. Thank you very much indeed. So that's all for the lumbar spine examination today. Thank you very much. Thank you.